Hello everyone, my name is Nadia Jones and I am a nursing student at Indiana State University's LPN to BSN program. This health education program is for nursing 444 community health. Head lice. Before we get started, please take a moment to pause this video and access the pre-test link featured in the video description below. Learning objectives. By the end of this presentation, all participants will be able to define head lice, describe the life cycle, identify the population at risk for lice, explain how lice is transmitted, recognize the signs and symptoms of a lice infestation, describe how lice can be treated, and identify prevention strategies. After program completion, all participants should be able to pass the post-test. General information. Averaging at 2 to 3 millimeters long, adult head lice crawl to infest the head and neck of human hair. Head lice are small, wingless insects that only live on humans and lay tiny white eggs called nits. Contrary to popular belief, anyone can become infested with head lice, even those with clean, healthy hair. Even though lice can be time-consuming to treat, they do not carry transmittable diseases. Secondary bacterial skin infections related to scratching are a concern, though. Negative feelings associated with infestation can also impact the quality and effectiveness of treatment. The life cycle. Pediculus humanus capitis is the scientific name for head lice. Lice feed only on humans and require blood several times a day. The life cycle of a head louse has 3 parts to it. 1. Eggs, also known as nits, are yellow or white, oval, and 0.8 millimeters by 0.3 millimeters. Viable nits are located within 6 millimeters of the scalp, are laid by adult females, and take about 1 week to hatch. Eggs are typically found at the temples, behind the ears, and at the back of the neck. 2. Nymphs, also known as the baby louse, are the size of a pinhead, molt 3 times, and take 7 days to mature to adulthood. During this time, the shell of the egg will turn a dull yellow and will remain attached to the hair. 3. Adult lice are about the size of a sesame seed, have 6 legs with claws, and are tan or grayish white. The color of the louse may appear darker on darker colored hair. Adult lice tend to stay close to the human scalp for warmth. An adult female can lay up to 8 eggs in a day and is usually bigger than the male. Adult lice live for 30 days when they have a human host. Without human blood, the louse will die in a day. Who is at risk for a head lice infestation? Although anyone can become infested with head lice, children in preschool and elementary school, along with the people who live with them, are most at risk for a head lice infestation. Risk factors include low socioeconomic status, households with lots of kids in the home, long hair, and brown hair. Infestations in longer hair are more likely to go unnoticed for longer periods of time and are harder to treat. Similarly, having short hair reduces the risk, while being bald eliminates the risk of head lice. According to Meister and Oschendorf, annual American infestation rates average between 6 to 12 million cases. Head lice is an extremely common problem in tropical countries. African Americans are less likely to get head lice, but that does not mean that they are not at risk. How are lice transmitted? Head lice spread through direct contact. Common locations for the spread of lice include schools, homes, sports activities, playgrounds, camps, and slumber parties. Engaging in the sharing of hats, scarves, coats, sports equipment, beds, and even holding heads together for a photo can increase the risk of an infestation. Infestations are not related to how clean a person or the environment is. The risk of getting infested by a louse that has fallen on a carpet or floor is low. What are the signs and symptoms? Typical signs and symptoms of head lice may include tiny bugs in the hair, nits attached to the hair, an itchy scalp, a tingling sensation like something is crawling across the skin, difficulty sleeping, irritability, a scalp rash, and pain or soreness after scratching. Itching is caused by an allergic reaction to lice. It may not occur immediately with a first-time infestation. Anemia is only a risk for severe, persistent infestations. Although lice do not carry disease, it is important to speak with a doctor if you have any of the following symptoms: itching that prevents sleep, a reoccurring rash, a scalp rash that lasts more than 1 week, persistent live lice after appropriate treatment, bleeding, or sores. It is also important to monitor the skin for signs of infection, such as swelling, redness, pain, draining, odorous sores, or fever. How are lice treated? Treatment is recommended for active infestations. If one person in the home needs to be treated, all other household members and close contacts should also be checked. Recommended medications may be over-the-counter, like Lice or Rid shampoo, or prescription, such as Lice. Check labels for age limits, as some products are harmful to young children. Pediculicides kill lice, some of which also kill the eggs. If the medication does not kill eggs, routine retreatment is recommended. If the medicine does kill eggs, only retreat if live lice are present days after treatment. Follow the instructions on the lice shampoo and wash the hair over the sink. Do not use regular shampoo, creams, or oils for 2 to 3 days to avoid interfering with the lice treatment. Do not apply lice shampoo on the eyelashes. Comb through the hair with a metal tooth comb to remove nits. Supplemental measures are recommended as well. Machine wash using hot water and machine dry hats, scarves, pillowcases, bedding, clothing, and towels used by the infested person within the previous 2 days. Nits are killed after exposure to 130° Fahrenheit temperatures for at least 5 minutes. Soak combs and brushes in hot water for 5 to 10 minutes. Vacuum the floor and furniture. Although the risk of getting infested by a louse that fell on the floor or furniture is low, vacuuming eliminates the risk. Items that cannot be laundered should be sealed in a plastic bag for 2 weeks. Shaving of the head is not a necessary treatment. How can a lice infestation be prevented? The following prevention strategies can prevent the spread of lice. Avoid head-to-head contact. Do not share hats, scarves, coats, sports uniforms, hair ribbons, combs, brushes, or towels. Disinfect combs and brushes in hot water for 5 minutes or 1 hour in lice shampoo. Do not lie on beds, couches, pillows, carpets, or stuffed animals where an infested person has been recently. Vacuum floors, furniture, and car upholstery. Check everyone who lives in the home for lice and nits. And do not use sprays or fogs. They do not control lice and are toxic to the lungs and skin. If you would like to learn more about this topic, please look at the references and resources below. Thank you. Now please take a moment to pause this video once again and access the post-test and brochure in the description below.